Hello, good evening. Good evening, all. You are welcome to today's presentation. I'm Dr. Chidiebele Ojukwu from the Department of Medical Rehabilitation, University of Nigeria, Enugu campus. You're welcome. The topic for today's presentation is entrepreneurship in physiotherapy, creating a niche for yourself. I had to mute all the participants so that we'll have a noise-free arena, okay? For those of us that are new users on Zoom, you will see a screen. When you get to the lower part of your screen, you can see where my cursor is now. If you get to the lower part of your screen, you see the chat icon. Click on the chat icon to drop messages in the chat room. You will also see the reaction icon. You can also click on reaction if you want to raise up your hand or maybe wave, and I'll see you, okay? Before we start, can we type in our names in the chat room so that I'll know who we have here? Type in your names in the chat room. Hi, Rita TV, I can see you. Dr. Odele, I can see you. Good evening. Galazi J4, you know, most of us didn't customize our devices with our names. So I don't know you, just type in your name. Obona, I can see you. Welcome all. In the next 2 to 3 minutes, let's do this. Obiefuna, welcome. Anthony, Ajayi, Dr. Dunia, welcome. Mekis, okay. Daniel, good evening all. Udore Ogechi, welcome. All right, let's move on. Nkiru, good to have you here too. Charity, you're welcome. So before we start, I want to share this picture with us. We can see this woman hiding behind a wall. That's what most of us are doing in this profession. And I want to let you know that if you don't say, here I am, nobody says, there you are. I want this to be our watchword for today's presentation. It has been my watchword for quite some time in the profession. If you don't say, here I am, nobody says, there you are. Nobody has time to look for you. You have to make yourself visible and noticeable. And that's one of the prompts for today's presentation, okay? Because most of us have been hiding behind the wall for so long, and it's time to get visible. It's time to start making impact, okay? It's time to start making some achievements in physiotherapy. What are we going to be discussing today? Today, we will take an overview of who an entrepreneur is. We will also look at physiotherapy entrepreneurship in Nigeria, its current status, needs for implementation, challenges. Then we will also look at opportunities for physiotherapy entrepreneurs. Then finally, we will look at some tips that can help us create a niche for ourselves. Who is an entrepreneur? It's not a new topic. We all have different scholarly definitions of who an entrepreneur is. But today, I'm going to use a non-scholarly definition because we're not in a formal setting. The most important thing is that we pass a message, okay? So by my definition here, an entrepreneur is someone who is not content with the current state of affairs and decides to take things into his own hands to bring positive changes in the world around him with his vision and scrappy attitude, while accepting all the risks and hardships that come along with it. What am I saying? For you to start thinking like an entrepreneur, you need to stop being content with the current state of affairs around you. You need to stop being content with your current state of unemployment. You need to stop being content with the current state of affairs in your working place. You want to do something different. You need to stop being content with the state of affairs in physiotherapy practice, okay? And then you want to take things into your own hands. You want to bring positive changes. You want to do something different that will make you stand out. How do you bring about positive changes? You must have a vision. If you don't have a vision, you are not going anywhere. You must have a scrappy attitude. Yes, scrappy means being willing to take risks and put yourself out there, okay? For you to be able to take risks, you should be able to accept all the risks and the hardships that will come along with it. Taking risk is not an easy one, okay? So this is who an entrepreneur is. Entrepreneurship is living a few years of your life like most people won't, so that you can spend the rest of your life like most people can't. For example, if you start thinking like an entrepreneur, some of the things you do today will actually be different from what others are doing. While others are just sitting in their cubicles or sitting in their offices, waiting for salary to be paid, you will start thinking or doing something else that others are not doing. It may not pay today, but in the next few years, you will start living a life that they cannot live. It's just a summary of what entrepreneurship is all about. Can we look at the characteristics of an entrepreneur? Most of us have been hearing this word. It's not new. And we have different perceptions of who an entrepreneur is. I want to let you know that there is no perfect entrepreneur. Yes, someone is asking me if I'm recording this class. Yes, I am. Thank you. There is no perfect entrepreneur. Some entrepreneurs may be quiet and hardworking, but yet they're doing something, they're brainstorming. Some may be more outgoing and flamboyant. We know people like this, okay? They're also doing something. They are entrepreneurs. Some may have so many staff and workforce. They are entrepreneurs. While others may work in isolation or with a very few staff. Some may not even work with anybody. They're just in their houses doing whatever thing they're doing on their own. They're entrepreneurs. Some may be very large business owners while others are not. The most important thing is that you are just able to generate ideas, to innovate, to develop marketable products and services. That's the most important thing in being an entrepreneur. We're going to look at some of the skills that are required of an entrepreneur. You may not have all these skills because no man is perfect, okay? But if you can have at least 80 to 90% of these skills, you are good to go, okay? You should also know that some of these skills are not inborn. You acquire some of them. I'll start with achievement motivation. For you to be an entrepreneur, you should be motivated to achieve. That is your main drive. If you are not motivated to achieve, then you are not ready to be an entrepreneur. People have motivations for various purposes. Someone may be motivated to just make money. Some other person may be motivated to be a leader, to be in power. But the moment you are motivated to make achievements, that makes you an entrepreneur in thinking. You have to be innovative. You find out that some of us are not innovative, even in practice. We keep doing the same old things that our ancestors were doing. Some of us have not invented any new thing since they came into physiotherapy practice. If you're not innovative, you can't be an entrepreneur. You have to be innovative. You have to generate ideas. You also have to be creative. If you are not creative, then you can't come up with new things. Creativity is all about coming up with new things or modifying old things to give them a new look. That makes you an entrepreneur. You should also be willing to take risks. How many of us can take risks? Some people said they can't hear me. What's the problem? I think it has to do with their speaker. Please, can someone just type in? They should check their speakers. Thank you. So you should be able to take risk. If you're unable to take risk, you are still dulling in the profession, okay? Taking risk does not mean making mistakes, actually, in patient care. We'll still talk about taking risks in one of our slides. Then you should have passion. Some of us are physiotherapists, but we don't have passion for this profession, okay? You should have real good passion. Even if you were forced to be a physiotherapist, you are already here. Except if you want to go into another field, okay? Even if you don't want to be a physiotherapy entrepreneur, whatever type of entrepreneur you want to be, you must have passion for what you do. Passion is the drive. It drives you, okay? And it makes you want to do more. You should see opportunities. How many of us have seen opportunities in this practice, apart from getting a paid job and sitting there waiting for salary? There are many opportunities out there. We're going to mention a few of them in this class, okay? We have to see opportunities in the profession and even beyond the profession. An entrepreneur should be optimistic. When you are optimistic, you are a positive thinker. If you are pessimistic, you can't be an entrepreneur. You have to be optimistic that whatever you are innovating, whatever you are creating, whatever risk you are taking, or whatever opportunity you are delving into will definitely work out, even if you face challenges. You need to be self-confident. I'm sorry to say, most physiotherapists are not self-confident, okay? We lack self-confidence as a result of many reasons. We are going to mention a few of them in the subsequent slides. When you are not confident enough, how can you walk up to someone to present a proposal? How can you walk up to someone to negotiate a business or to negotiate clinical practice if you are not confident? We will look at it subsequently to see some of the things that hamper our confidence. Independence. Independence is one of the key words in becoming an entrepreneur. If you're an entrepreneur, you should be independent in thinking. Independence doesn't mean that you don't take instructions from your superiors. No. It doesn't mean you are a no man. In fact, you work alone. No, that's not what I mean. Independence means being able to think independently. You're not depending on people for everything. How many of us have achieved professional independence in this profession? Even if you are working for the government, even if you are working alone, you need to be independent in your thinking. And when you make innovations and you come up with creative ideas, you see them working. But when you keep being dependent on people, then nothing is working, okay? Another thing is team spirit. You can't work in isolation. In fact, in the world we are now, team spirit is the way forward. If you can't work with your clients, if you can't work with your colleagues, if you can't work with people in other professions, if you can't work with even the non-professional individuals you come across with, I wonder how you can thrive as an entrepreneur. Leadership abilities. Leadership abilities, in fact, you mustn't be in a leadership position to possess leadership abilities, okay? For you to possess leadership abilities, you should know that even when you are working with yourself alone, you are a leader. Even when you are working with your clients, you are a leader, okay? So please, let us develop leadership skills. You can train yourself to be a leader, because if you are not a leader, you cannot be an entrepreneur. You need to be able to make decisions. We were all trained to be able to make clinical decisions in practice. You need to step out and make other decisions apart from that in clinical practice. Have you seen a businessman or woman that cannot make or take decisions? It's not possible. You should be able to take decisions. You should be able to know that this is right or this is wrong. You should be flexible. Flexibility matters a lot in practice. If you are not flexible, you are rigid. When you are rigid, you stick to old practices. When you are rigid, you conform to only one pattern, okay? The world we are in is changing. The only constant thing is change. As an entrepreneur, you need to be able to adapt to changes. If the business market changes, you change. If the medical profession starts changing, you change. You find out that, okay, for example, we are talking of COVID-19 now. Last year, who was talking about that? Nobody. I'm sure that most of us in the last year never picked up a cardiorespiratory textbook. Most of us didn't. But because we're talking of COVID-19 today, many of us are beginning to read cardiorespiratory articles because we want to fit into the current trend in practice. You find out that we have epidemics that change over time. We have a lot of things, cultural changes in our environment. You should be flexible enough to fit into them. Then, how dynamic are you? If you are dynamic, you should be able to fit into any kind of practice. You should be able to work with anybody. But if you're not dynamic, then you find out that you can only work with a particular group of persons. And that doesn't make you an entrepreneur. Courage. If you don't have self-confidence, you don't have courage at all. Even if you have self-confidence, you may not even have courage, okay? You need to be courageous to do new things. You need to be courageous to say that, oh, I'm making an innovation. I'm coming up with a new idea and I want to bring it open. I want to make changes in my practice. It takes courage to do that. It's only when you are courageous that you can take risks. The last but not the least, negotiation. How many of you can negotiate? You think it's only politicians that are supposed to go into negotiation? You think it's only those bidding for contracts that should go into negotiation? That's not true. As a physiotherapy entrepreneur, you should be able to negotiate. Sometimes you even negotiate with your patients or clients without knowing. When you tell your client to do this and he's saying, I don't want to do this, or I can't come 2 times a week, and you're telling him, see, you really need to come 2 times a week because that's the only way we can achieve results. You're already negotiating, okay? Most of us have negotiation skills, but they're poorly developed. If you don't have them at all, you need to develop them. Because for you to be an entrepreneur, you keep negotiating. You don't bring up an idea, and when it's, trashed, you say, let me go and rest. Go and rest where? You go and modify it and come back again. Finally, you need to have very strong sense of values. It's very important. Remember that as professionals, we have professional values. We have clinical values. We have ethical values. We have cultural values in our environments. If you lack a strong sense of values, you won't make a good entrepreneur. You can only try for a very short time, and before you know what's happening, people will know what you are doing. Yesterday, someone asked a question. He said, because I told them that if you see a condition that you cannot manage, okay, I used it as an example. You refer that patient or that client to the appropriate person that can manage that condition. Don't take up every patient that comes to you. And someone asked the question. He said, if you refer your patient back to the physician or maybe to another health personnel, that means you are losing your clients. And I said, no, you're not losing your clients. You don't take up what you can't do. You should have professional values. If I can't manage you, I won't manage you. If you really need to go back to your physician before you come back to me, I'll send you back to your physician. But if you don't have a strong sense of values, you grab everything around you. And at the end of the day, you make mistakes. And now I asked him, if you manage that patient, assuming the patient needs to go back for something else before you continue therapy, and you decide to hold back that patient, you can manage that patient for the next 2 to 3 months and you're not getting results. What will happen at the end of the day? The patient will get frustrated. The patient will leave you. The patient will go out and tell people that you are not doing anything meaningful in your practice. And then what does it mean? Okay, that means that you've lost that patient and you probably lose more. So when I'm just using this as an example to illustrate a strong sense of value. There are so many of them. We're not in an ethical class. When we come to an ethical class, then we will elicit more, okay? Now let's look at physiotherapy entrepreneurship in Nigeria. Where are we? Where are we actually in physiotherapy entrepreneurship in Nigeria? What are we involved in? And is that enough? Whatever it is we're involved in, is that enough? Can you kindly type into the chat room? I want you to tell me what we are involved in or where we are. If you have any opinion on this, this is an interactive session. I won't unmute us so that we won't, some of us have very noisy environments. So let's just use the chat room, okay? Tell me where we are. What are we doing? What are people doing as physiotherapy entrepreneurs in Nigeria? I'm waiting. Is somebody typing? Nobody has an idea of what we are doing. Yeah. Okay, let me continue. I think in Nigeria, okay, PP, PP, that's private practice. That's the commonest thing we do here. Thank you, Charity. Seminars, okay. What type of seminars? Okay, Rita said we are still at a teaching stage. Yes, so, okay. Charity, what type of seminar are you talking about? Workshops, okay, okay. Those workshops, are they really entrepreneurship based? Are they really entrepreneurship based? Or is it the ones that our associations are organizing? Are we coming up with ideas? Even in those workshops, are they enough? Are we doing new things? Are we doing old things? Okay, some are. Okay, I think we relate entrepreneurship with only private practice. Very good. Okay, okay, okay. Onyeso said we are doing home care practices. Really? That's what we've been doing, home care practices and private practice. Okay, let's go to the next slide. Okay, Omodigbo, I can see you. Okay, Techno, I don't know your name. We're still not there. Everybody believes in home care, No one cares about primary health care involvement, okay? Policy making, okay? Okay, okay. All right. So, Prosper, okay, we are where we are because most people do not have the spirit of entrepreneurship. Very good. Okay, Anganti Daniel, okay. Physiotherapists own clinics. That's private practice now. That young PTs are used and paid lesser amount. Young PT, why will you allow people to keep using you? Develop your own. That's what we are talking about today. Physiotherapy online courses and educative platforms developed. Really? Okay, we are yet to see more of them. We're not daring enough. Yes, we are not. Okay, private practice is not enough. I want to practically tell us today that private practice is not enough for us. Okay? And this man is asking me why. See his face. Why? No funding to start your own practice. Okay? We are going to tackle this your problem today. No funding. Okay? Untapped potentials. Really? Yes. Okay. A physiotherapist in private practice may not necessarily be an entrepreneur. Honestly. You are a private practitioner. That doesn't make you an entrepreneur. Yes. Do you know why? Because you are probably just self-employed or you are just a business owner. You are not thinking or acting like an entrepreneur. Don't you agree that most of the people who have private practices, who have private clinics, who are doing home care, do not think or act like an entrepreneur? Okay, so this man has put hand on his head. Probably he's one of the people that has been into private practice for donkey years. And he has been considering himself an entrepreneur. Okay, you are not an entrepreneur if you don't think or act like an entrepreneur. Okay, let's look at the difference. Most of us are confused. What's the difference now? Why am I different from an entrepreneur? Yes, if you're a private practitioner, really, you have great ideas. Because if you don't have great ideas, you wouldn't have thought of going into private practice. You wouldn't have thought of setting up a clinic in your community to solve instant problems. You are a private practitioner. But if you are an entrepreneur, you won't just have great ideas. You have big ideas. You start thinking big. You come up with ideas to grow. You don't want to remain where you are. If you appraise your private practice, for those of us in private practices, you find out that what you were doing last year was probably what we were doing 5-10 years ago. And that's what you are still doing today. An entrepreneur grows. You want your business to grow. You come up with ideas. You don't stick to going to patients' houses and treating them, and that's all. That's not all. If you're an entrepreneur, you project into unseen areas. Let me give you a typical example. Last December, we started hearing of coronavirus in China, Wuhan. And most of us, in fact, in our wildest dreams, we never thought that COVID-19 will come to Nigeria. What made us think that way? Are we magicians? Why won't it come? If you are an entrepreneur, for those of you in private practice, you would have started making plans. You would have started making noise a long time ago that my practice is into, we do cardiorespiratory therapy. I'm a specialist in this. You start taking up some trainings immediately on cardiorespiratory care. You start reading up things that will equip you to manage this coronavirus in case if it comes to Nigeria. But I'm sure that most of us didn't do that. Now it is here with us. Now that it's here with us, everybody is running helter-skelter. We are seeking relevance with government, and government is too busy to even notice anybody now. They're noticing the doctors, they're noticing the nurses, they're noticing the pharmacists, because they've been making some noise on their relevance in such areas. But we were not making any noise before. Okay, so as a private practitioner, if you had entrepreneurial thinking, you would have started equipping yourself. Some of us would have thought of, let me see if I can buy a ventilator or two in case. Let me see if I can buy some of the things that are required for managing these patients. I don't know if anybody did that. We've not seen that person. The person has not made any noise for us to notice him or her. So that is enough to let you know that most of us are just private practitioners. We don't think like entrepreneurs. We don't have big ideas. We don't project into the future. We are only interested in solving instant problems. A private practitioner has narrow schedules. What you are interested in is how many clients are here today. Okay, you manage them and that's all. How many patients am I going to see? You go to their houses and that's all. If you are an entrepreneur, you are not interested in narrow schedules. It's not enough. You make future plans, just like I said before. If you're an entrepreneur, if you're a private practitioner, you are risk averse. You know what being risk averse means? You avoid risks. I beg you, I don't want this one. No, I don't want to delve into this. What if it happens this way? I beg. That is the way a private practitioner thinks. We are always we're always avoiding risk. But if you're an entrepreneur, you are a risk taker. You discover ways of managing risk. You take risks, you discover how to manage them. At a point, you even start learning what risks you can take and those you cannot take. Okay? Then you have diverse ideas on what risks are important, okay? Which of these are going to affect my patient care, and so on and so forth. That makes you an entrepreneur, okay? So you take risk, you discover ways of managing risk, you know what risks you should take, and that's which you cannot take. Someone is saying that a friend bought a face mask, okay, for 13K, and now he's selling for 450K per carton. You see, that's an entrepreneur. How many physiotherapists did something like this? Many of us didn't. Okay, now A private practitioner is cautious and conservative. They're very rigid. Whether you like it or not, most of us are rigid in practice. We don't make changes quickly, okay? And we stick to traditional methods of practice. In fact, an entrepreneur will want to spice up his practice. An entrepreneur is courageous and radical, okay? A private practitioner will keep working hard, but an entrepreneur works hard and smart. See, people are making billions of money, billions of naira or dollars in this world, okay, simply by working smart. But if you keep working hard, you treat a patient, oh, you get so exhausted. Before you know what's happening, you go and eat 3 plates of food, and the next day you start with the same routine again. See, think like an entrepreneur. It's not all about working hard. Work hard and work smart, okay? A private practitioner is only at ease in his or her natural habitat. Very good, very, very good, okay? Okay, let me see. Okonkwo is saying the intra-professional squabble in our profession would not make physiotherapy profession to be heard. Okay, we need unity, we need synergy. Of course we do. Okay, definitely we should be heard on our possible role in COVID-19. Okay, intra-professional squabble. Okay, we're going to talk about that. Okay. Then I want you to know that private practice shouldn't be your end goal. A private practitioner sees private practice as the end goal. They have no plans of scaling their business. But an entrepreneur, you are never content wherever you are. You want to keep moving, okay? That makes you an entrepreneur. I can see most of us are following. Some are not following. Oh. If you are following, type into the chat room. I'm following. I'm doing this. I'm doing that. Let me see you. Let me hear from you. Charity said she wants to believe that entrepreneurship is not exploitative. Of course, it's not exploitative. Okay. So are we saying that some of us may misunderstand what an entrepreneur means? We're not saying that as an entrepreneur, you should quit practicing clinical decision making. No. As an entrepreneur, you shouldn't be unprofessional, okay, or unethical. No. Now, as an entrepreneur, you should integrate entrepreneurial thinking into your clinical practice. Charity, you said buying face masks, 13K and selling for 50K is exploitative. Anyway, depends on how you want to look at it. Oh. Different strokes for different folks anyway. So, what we are saying is that as an entrepreneur, you shouldn't lose your sense of values. I've said this before, okay? Integrate entrepreneurial thinking in your clinical practice, in whatever you do, and you will make a difference, okay? Let's look at some of the reasons why we need to become physiotherapy entrepreneurs. Entrepreneur that I've been mentioning. I think I've said it up to 20,000 times today. Why do we need to become physiotherapy entrepreneurs? I can see you all. You are following. Smiley Angel, well done. Grace, you are welcome. Okay. Now, number one, see this crowd. Everybody is struggling for maybe 3 slots of job in a particular hospital. Unemployment is a major factor. Whether we like it or not, we don't have enough employment opportunities, especially for the young physiotherapists, okay? See, let me tell you, you find out that when hospitals come up with adverts for a job, they only, they may just specify a few slots for physiotherapists. And specifying few slots for physiotherapists, you see a very large number of physiotherapists coming to apply for that job, struggling with their CV, struggling with their letters. This is what we know how to do. My dear, you can quit struggling by becoming a physiotherapy entrepreneur. I'm not saying you shouldn't look for a paid job. I'm a civil servant too, and I'm enjoying it, yes. But in a situation whereby there is no job, find a way. Okay, and that's why we need to have this entrepreneurial thinking in us. Now, even if you have a paid job, even if you are a physiotherapist and you have a paid job, do you know that that paid job may not be enough for you? See this man wearing suits, ogbonge suits, okay, looking very fresh, but there is nothing in his pocket. A lot of us are like that. We are working, we've even gotten to the peak of our career, and yet we have nothing to show for it. I can remember, I can remember when I was teaching my MSc students, and I can't remember the topic, but one of them said that one of the reasons why they are not motivated in physiotherapy is because their predecessors, the senior colleagues, are not living well. That if you see medical doctors that are very rich and so on and so forth, but physiotherapists are just there. Anyway, I don't know. I don't blame him, no problem. Okay, so see what I'm saying. This man now is earning salary, but that salary is not enough. He has to look elsewhere. Even if you are earning salary, it doesn't stop you from being an entrepreneur, okay? Then another thing is the large population of Nigerians. We have a very large population in this country. The physiotherapist populace ratio is quite high. I want to let you know that if you divide us amongst Nigerians, a physiotherapist may get hold of 1,000 Nigerians, okay? So what am I saying? We have a lot of people clamoring for our services. We are not even enough. And we are there struggling for job in the hospital. We are there killing ourselves in one government hospital, okay? What am I saying? Because we have so many people clamoring for our services, everybody needs physical therapy. Whether you are healthy or not healthy, you need a physiotherapist. We are not enough. Okay, see, let me tell you, the people you see in the hospital are just about, in fact, I don't think the people we see in the hospital are up to 20% of Nigerians. They're not, okay? So we have people out there who don't even come to the hospital. We have a lot of people, and then we need to reach out for them. That's why we need to become entrepreneurs. We need to start creating more jobs. We can't keep dwelling on government job. Government job can never be enough. Government can never satisfy every graduate. It's not possible. Even if you use juju on government, government cannot employ everybody. It's not possible. So we need to create more jobs. If you become an entrepreneur, you start employing people. Be an employer of labor. Okay? For those of us that are saying that we are employed, the senior colleagues are employing the younger ones and are paying them peanuts. Oh, yes. You don't blame them sometimes. I'm not making excuses for anybody. But if you are not content with that, become independent, okay? Become independent and go and create more jobs so that you will employ people and start paying them. We need professional visibility. I talked about making noise. See, let me tell you, if all of us hide ourselves in government hospitals, if all of us remain in civil service, we may not gain that professional visibility we are looking for. We need to come out and become more visible. We are still hiding behind the wall, okay? You remember that picture I shared in the first slide? That woman that is hiding behind the wall, she's not visible professionally. The moment we start shining like this bulb, that's when we become visible in this country, okay? So let's become entrepreneurs. When we have a lot of people making achievements in this profession, making noise, okay, coming up with new ideas, that's when we start becoming visible. Increased incidence of non-communicable diseases is also another reason why we need to get more proactive. Whether we like it or not, the incidence of non-communicable diseases and other diseases are on the high side, okay? We need to reach out to these people. We have a lot of people clamoring for us as patients, okay? So we need to do more so that we can satisfy our clients. And we can't do that by remaining in government hospitals only. After work, think of other people that you can impact on. Increasing work-related and environmental hazards. This man, see the way he's working in his own office or be his own house. This is not different from what we see in a lot of occupations. So many people are in this situation, even if they're not doing exactly what this man is doing. They're not living up to good quality working standards, my dear. We need to reach out to these people. And then with the invention of entrepreneurship, many people are going into manual jobs, and there are a lot of occupations. We have diverse occupations now, and most of them don't even know the right way to do things. Ergonomics, okay, it should make us to even start making some noise, but yet we're not making that noise until we start having some other people that will come and take over that area of practice. That's when we'll wake up from our dreams. Now, we've done so many studies, and I've also read a lot of studies on work-related musculoskeletal disorders. When we do these things, we just put them in our shelves. Once we publish them in a journal, we go back and rest. It's not enough to publish them in a journal at all. It's not enough to present them in a conference. Are we reaching out to those people? That's another thing, okay? Every occupation has its related hazards. Let's reach out to more people. Then lifestyle changes. Lifestyle changes are the in thing now. Everybody wants to live healthier. Everybody wants to look trim. Everybody wants to eat natural food. Everybody wants to use organic or natural products, a lot of things. You can't talk of natural health. You can't talk of physical health without thinking of a physiotherapist, because exercise is behind all these things. A doctor invited me sometime last year to his clinic to come and take up antenatal classes for his pregnant women. And he told me something. He said, Asio, I'm beginning to think that in the next 5 years, doctors will start getting poor. I said, why? He said, yes, in the next 5 years, people are going to be so dependent on physical and natural health that nobody may even want to come to the hospital again. What does that tell you? Physiotherapists are becoming more important. And that is why we need to grab these opportunities and become entrepreneurs. Creativity and innovations. Without entrepreneurship, there's a limit to what you can do. Remember that when you are in the hospital, your chiefs are guiding you. There are some things you come up with. Your guy will say, no, don't do it like this, do it like that. But it's only when you become independent that you can get more creative and more innovative, okay? Clientele preferences. Most of our clients don't even like coming to the hospital, because when you come to government hospitals, you may get delayed, you may not get the special care you need. So most of them want to go to private practitioners. That is why those in home care are making a lot of money, okay? So clientele preferences should also spur our interest into entrepreneurship. Then community support. What is community support? Community support is, getting into activities or rendering services that will benefit your community. Most of us don't think of community support. We don't know that when you support your community, see, you will become more relevant, you will make some noise, and then people will start noticing you more than they used to notice you before. You start getting referrals and so on and so forth. Okay, so this is another reason why we should go into entrepreneurship. Now, let's look at some of the challenges we are facing as physiotherapists in the profession. As entrepreneurs in physiotherapy. Most of us want to get into entrepreneurship, but we have challenges. Most of us are already entrepreneurs, but we still encounter challenges. Let's look at some of them. Financial constraints, okay? Someone is asking me, is this still an interactive class? If I keep responding to everything in the chat room, then I may not flow with the slides, okay? But just know that after the last slide, when we get to the last session, I'll read up some of your comments, okay? So let's just continue. Financial constraints, this is a major problem. Some want to do this, some want to do that, but they don't have enough money to do it. But I want to tell you that there are still a lot of things you can do without so much money in your account. You can still do something without so much money in your account. Know that. Nigerian healthcare policy on PT services. Oh yes, Nigerian healthcare policy is not helping. If we are first contact practitioners, it would have been easier for those of us in private practice. You find out that we are always dependent on the doctors for referrals, okay? If you don't get a referral, you don't get clients. It's a major problem. But there are still some things you can do that doesn't require referrals, that doesn't require that you should go through a doctor, okay? Then poor knowledge and skills of entrepreneurship. If you don't have those skills I mentioned earlier, if you are not knowledgeable on entrepreneurship, you may not make the best out of it. Most of us were not trained in school to become entrepreneurs. Some of us will say that we grew up in civil servants' homes, okay, so we cannot become entrepreneurs. What happens to training yourself? What happens to practicing and learning from experiences, okay? Limited interprofessional socialization. Because we're having a lot of interprofessional problems in the healthcare industry, it's affecting us. It's affecting whatever we are doing. I want to let you know that if we have better flow with people in other professions, it may be better for us. You find out that this interprofessional socialization is affecting the referrals we get. It's affecting the relevance we get, okay? But see, let me tell you, we shouldn't keep waiting for other people to come looking for us. We can go looking for them, yes. That's how an entrepreneur thinks, okay? Lack of specialization. And another thing, interprofessional socialization has to do with people in other professions knowing what you do. You know that most people in other professions don't even know what we do. Even those that know pretend that they don't know, okay? But let me tell you, whether they know or they don't know, it should stop being a limitation, okay? Lack of specialization. Specialization is a serious problem in Nigeria. Physiotherapists don't think of specialization, okay? We should know that specialization makes you an expert. If you're not an expert, you're just a jack of all trades. You are everywhere. You're just like a shadow, okay? You need to be known for something. If I think of women's health, I should think of you. If I think of orthopedics, I should think of that person. If I think of exercise immunology, I should think of this. You know, people should remember you when something is raised, okay? You need to specialize. I'm going to have a training on specialization, okay, very soon. Then, poor health-seeking behavior of Nigerians. Nigerians are not also helping matters. Poor health-seeking behavior. They don't go to the hospital until they get bedridden. They don't go to, even when you refer them to physiotherapists, on their way, they will throw away the referral note and go back home. Yes, they don't have good health-seeking behavior. But let me tell you, when you make some noise, you can bring out that health-seeking behavior in them, okay? If they know the consequences of some of the things they undergo or some of the things they're going through, they will definitely develop a very good health-seeking behavior. High cost of physiotherapy services. Sometimes most of us are very, let me not say, in fact, the cost of physiotherapy services sometimes are alarming. I understand that, yes, we put in a lot in patient care. But see, let me tell you, when you become an entrepreneur, you are not just interested in managing 2 clients that will pay you 20,000 in a week. You want to step out. You want turnover in whatever thing you are doing. Turnover is the spirit of an entrepreneur. You want to have so many people clamoring for you. You want to generate traffic, okay? You can't generate traffic by having only 2 clients, okay? So we need to restructure the way we place charges or maybe our billings. Some of us don't even consider the environment we're in. Some people are in rural areas and they're charging like those in FCT. How many clients will you get if you are behaving like that? Okay, so, and let me tell you, remember that a patient can go to the pharmacy and get a card of Panadol for 50 naira. Once they drink that Panadol or paracetamol, they'll feel better with their headache. But you know that most times physiotherapy services are long-term. Because they are long-term, if you charge so high, they don't keep coming. They will only come for a session or two. Before you know what's happening, they abscond. Let's find a way of striking a balance, okay? Let's also get innovative. There are some things you do that will help you save cost in practice. It will also help you get more positive outcomes, okay, without charging your patients very high. Quackery. Quackery is a serious issue. When we talk of quackery, what comes to our mind? The first thing that comes to our mind is those people that are claiming to be physiotherapists, but they're not physiotherapists. That's the first thing that comes to our mind. Yes, we have a lot of quacks everywhere, flaunting themselves as physiotherapists. Something you will do for 5,000, they can do it for 1,000 because they don't really know what they're doing. Okay? Yes, I agree. As much as the regulatory board is fighting quackery, okay, let's stop seeing it as challenges. By the time you create a niche for yourself, a quack cannot intimidate you. Secondly, the truth is that some of us also think like quacks. I'm sorry to say that. If you are thinking like a technician, if you have shallow knowledge, okay, there's no difference between you and the technician. And what that quack is doing in his clinic is what you will also do in your own clinic. We also have quacks. We also think of quacks when we think of all these traditional bone setters, those in alternative medicine, and so on and so forth. I want to tell you something. The moment you stop seeing them as competitors, the better for you. A traditional bone setter is not your competitor. Everybody is striving to survive in this world. The way you are striving to survive, that traditional bone setter is striving to survive. You won't stop them from doing what they're doing. No matter how much laws you put into place, they'll keep practicing. And the truth of the matter is that traditional medicine is gaining relevance so fast now. So stop seeing them as your competitors. Stop seeing them as quacks. If you develop yourself well, if you create a niche for yourself, they cannot compete with you, okay? So the moment you sit down in self-pity saying that, all these quacks, that's spoiling market for us, you are wasting time. And yes, we keep passing, okay? Let me tell you, as physiotherapists, some of us are quacks. Last December, my mom had a knee replacement in a peripheral hospital in a southeast here. So we were sharing a room with another patient who had a hip replacement. And that woman had a hip replacement about 8 years ago, somewhere in the West. She said she had a replacement and on the right hip, and then she came back for the left hip or so. And after the surgery, the physiotherapist was invited to see her. She refused though. I kept convincing her, see ma, you need physiotherapy. Oh. This Indian surgeon that did this surgery has traveled back home. It's only your physiotherapist that will push you. And she said, no, physiotherapists are quack. Yeah. I said, see this woman. She said that when she had the first replacement, that the physiotherapist that managed her, the first day the physiotherapist came, the physiotherapist dislocated the implant, okay? And she had to spend about 3 to 4 months in the hospital. In fact, I kept on convincing her. I told her, anyway, it may just be a personal issue. She didn't allow the physiotherapist to touch her. In that case, is that physiotherapist not spoiling market for the rest of us? So what am I trying to say? Some of us are quacks. When we talk of quackeries, or when we talk of quackery, we should stop thinking of only others in different professions. Then some physiotherapists also employ quacks in their hospital. If you employ a quack instead of employing a physiotherapist, you are not creating job for young ones that want to become independent or maybe want to, get into private practice. But then let me tell you, when you employ quacks in your clinic, you're not thinking like an entrepreneur. An entrepreneur will want to employ the best because he or she wants his business to scale. If you employ quacks, you will remain at a place. Inconsistent power supply, serious matter, because most times we use electrical modalities, okay? And if you keep running petrol, you find out that most times you spend a lot of money running petrol and you don't even make it in a day. It's a big problem, but like I told you, there are still some things you can do that may not even require power supply. Taxation and law enforcement, that's another issue. Once you open a clinic or once you set up a private practice, you find out that you have a lot of people coming for local government payment, one thing or the other, and so on and so forth. It's common in all the states, and it's a problem. Sometimes after paying all these service charges, you don't even make them. Physiotherapists' personality issues, that's another one. Some of our young physiotherapists, or even the old ones, who are entrepreneurs, are impatient. My dear, once you are impatient, you won't thrive as an entrepreneur. You need to be patient. It's not easy to be an entrepreneur. You have to build your business. Give it some time to grow so that you don't keep jumping in and out of business, okay? Then we also lack mentorship in the profession. If you lack mentorship, it's difficult for you to come up with innovative ideas and so on and so forth. Mentorship is necessary for an entrepreneur because you need to learn from people. But you find out that in our practice here, most people bottle up what they know. Nobody wants to share. You know something, you keep it to yourself. Because if you tell Mr. A will grab it. Let me tell you, if Mr. A grabs it, does it stop you from being who you are? It doesn't. The sky is too wide. It can take all of us. So let's become better mentors so that we can trigger innovativeness, independence, entrepreneurial thinking in one another. Non-creativity, I've talked about it before. If you are not creative as a physiotherapist, you cannot be an entrepreneur, okay? Educational limitations, shallow knowledge. Shallow knowledge is not a small matter. If you have shallow knowledge, like some people do, you won't thrive. You need in-depth knowledge to thrive in the profession. See, even if you are selling something in a local market and you don't have good knowledge of what you are selling, your clients will not keep coming. If you go to the market to buy pepper and you ask the woman selling the pepper, what type of pepper is this? Is it from Jos or is it from Kanu? And she says, I think it's from Jos, so I think it's from. You won't be motivated to buy that pepper from her. This woman, you are selling pepper, you don't know the brand you are selling. So whether you like it or not, you need in-depth knowledge in everything you do. It will also build your self-esteem. It will build your confidence. It will build your courage, okay? Now, I know I've not listed all the challenges. You may have more, okay? But whatever it is, these challenges are. Despite all these challenges, we need to keep pushing in the profession. We can't keep waiting. We can't keep waiting for anybody to fix them for us. We need to fix them ourselves. Push yourself because no one else will do it for you. That is it. Then let's quickly look at opportunities for physiotherapy entrepreneurs. Are we there? Am I making sense? I want to see you typing in the chat room so that I'll be sure my network hasn't even logged me out. Are we there? Opportunities for physiotherapy entrepreneurs. I'll start with home care services, which is what we have been doing and what we are still doing, and what I'm saying that we can continue doing, but shouldn't be limited to it, okay? Home care services, very important. Outpatient clinic is another thing. Most of us run outpatient clinics. You can either run it as an entrepreneur or as an intrapreneur. Entrepreneur, there's a little difference between And yes, I can see your responses. Thank you. As an entrepreneur, you can run an outpatient clinic. You can set up a new clinic independently, okay? As an intrapreneur, you can run a clinic in an already existing practice. Now, when we talk about outpatient clinics, many of us have rented flats or have rented duplexes that we are using as outpatient clinics. Very, very good. Good effort. Some of us are working in private hospitals. Most of us have small clinics in private hospitals. Good enough. Now, I want to let you know that outpatient clinic must not be in a flat or a duplex. Neither should it just be in a hospital. You know, you can set up clinics in a marketplace. Do you doubt that? You can set up a small clinic. In fact, you can even embed yourself inside a market or inside a shopping mall where people come to. You mustn't be in a hospital for it to be a clinic, okay? As long as I just use the marketplace as an example anyway, okay? What I'm trying to say is that an outpatient clinic can be anywhere. You can go to a bank and set up an outpatient clinic in a bank. They give you a section for your clinic. You are not just seeing their staff alone. You start working there as a staff. You start doing ergonomics training and so on and so forth for them. Before you know what's happening, you are servicing so many branches. For example, if you know how many branches Zenith Bank has, okay? Excuse me, check. 1 minute, please. Okay. So you start setting up so many branches, okay? Sorry, I have okay. So okay, sorry about that break in transmission. Okay, well then an outpatient clinic can be anywhere. That's what I'm trying to say. Emergency support services. How many of us have delved into emergency support services? So many of us have not. There is federal road safety. There are many emergency support services in this country. People are making money from these things outside the country. Okay, somebody will tell me that they're not employing us in road safety, they're not employing us in this or that. Will you keep waiting for them to employ you? Can't you organize trainings for them? Can't you reach out to them? You can. Okay, you can make a difference. Reach out to these people. See what you can do with them. Do some presentations for them. Before you know what's happening, they start calling you. How many of us are into sports therapy? Sports is the in thing now. People can sell their phone just to watch a football match. Okay, people can do anything. They do sports betting, a lot of things. That's it. See all these people that are doing bets, Niger. They know that there is money in sports and they're delving into it. We have very few physiotherapists in sports, and yet we are complaining that we don't have jobs. We have sports teams everywhere, even in our villages. Can't you walk up to them? Can't you start doing one thing or the other? Who are you waiting for? You are waiting for MRTB to go and tell Ministry of Sports Affairs, I'll be waiting, that they should start employing us. While MRTB is doing their own, do your own. Okay, stop waiting. Let me give you a typical example. In 2008, when I was an intern, they were planning NUGA Games. You know NUGA Games, Nigerian Universities Games Association or so. It's done in every, I think that year it was to be done in University of Nigeria. And I was just coming back from work one day. I saw the billboard, NUGA Games, upcoming. I said, sports. I picked the number of the person in charge, which I saw on the billboard. I called him, a then professor of UNM. I told him, I'm a physiotherapist. Have you made any arrangements for physiotherapists? He said, it even took him time to recognize who a physiotherapist was. And then he said, physiotherapist, for what? I said, sir, you are planning NUGA Games and you don't have physiotherapists. We need to be there. Who is in your medical team if we are not there? And then he said, really? Please come to Nsukka. I flew to Nsukka the next day. He said, tell me more about it. I told him. And then he introduced me to the person in charge of the medical team. The man said, wow, they already recruited doctors and nurses. And they didn't think of physiotherapists. Why? Because we've been hiding behind the wall. That was how they said I should go and bring some of my colleagues. And we worked in Nuga Games for 2 weeks or so. So what am I trying to say? There are many sports events ongoing everywhere. Football is not even the only sports event. As a physiotherapist, you have knowledge of biomechanics. You have knowledge of kinesiology. Who can do it better than you are? Nobody. So we need to reach out and get into sports therapy, even at local levels. Occupational health. I told you that every occupation requires the intervention of a physiotherapist. If you doubt me, type in any occupation now, and I'll tell you how we can be of use to that occupation. Let me give you an example. Dangote cement, okay, you know what cement can do to the cardiopulmonary system. I've seen a lot of studies among cement dealers. I've seen a lot of people doing works on exposure to cement and sawdust and soda and so on and so forth. Why can't we walk up to these people? And there's competition in every business facet in this country. If you walk up to Dangote, for example, now, and tell him that, can I collaborate with you to educate cement dealers on this or on that to improve pulmonary functions? Do you think he will say no? Everybody wants to create a niche in their business to make them better than some other person. The other day I went to Timber Market. I saw posters all over the place. You know Lafarge Cement. Lafarge Cement was distributing posters to their wholesalers. Okay, on the poster you will see two men, one lifting cement in a wrong position, one lifting in the correct position. And I bet you that idea of Lafarge Cement was not stimulated by a physiotherapist. But these are things we can do. We can tell them, so, and you know, because of that poster, Lafarge Cement was distributing to their wholesalers. You will see people that may want to buy Lafarge Cement so that they can get one of those posters. Let us get into occupational health. We have, okay, in fact, there was a study we did among people that grind foodstuffs in the market. People as low as that. And we found out that those machine grinders, oh my God, they had serious work-related musculoskeletal disorders. So even the least occupation you can think of, okay, needs you as a physiotherapist. What am I telling you? Let us get into occupational health. The sky is too wide for us, but we are not utilizing these things. Health and fitness services. I've told you that healthy lifestyle is the in thing now. If you don't want to slay, you are wasting time. People are getting into beauty, you know. I want to tone my skin. Do you know that a lot of people are into integumentary care, but they're not physiotherapists? Many people are using exercises to improve skin glow. There are particular exercises that will help you with all these things. They will tell you that if you engage in this or if you engage in that, before you know what's happening, your skin will start. And we're not anywhere near to these things. Most people are into weight loss. You have fitness centers everywhere. People are grumbling. Plenty fitness centers. Physiotherapists are not there. MRTB should do something now so that they will start them. Who are you waiting for to employ you in the fitness center? In as much as MRTB should influence all these things, but we won't keep waiting for them. Walk up to these fitness centers. Tell them what you do. You even know more than those coaches. I can remember when I was attending one fitness gym, and the coach was telling us to do one exercise. We told him, this exercise, what is it for? He said, it's to strengthen your spinal cord. Yeah? I told him, which exercise is for spinal cord again? And everybody believed him, except me, because I knew more than him. So why can't we step into these services? Why can't we even set up fitness centers? Why can't we set up disease-specific fitness centers? You think you need the whole world to do that? You don't need it. You can even start from your homes. I know a woman that lives very close to me. A woman that lives very close to me, and she turned her house into a fitness gym. No equipment, oh. People just come there on Saturdays to do aerobics. She's not even qualified, but she's doing it, and people are paying her heavily. My dear, why can't we do these things? Do you need a treadmill for you to set up a gym? You can just start with aerobics, and then before you know what's happening, you are there. We can get into disease prevention and management, okay? Go into health fitness services. For example, I have a group online for preggies and mamas, okay? For people that are pregnant, and because I'm in women's health, that's my field. And when you come there, I tell you, I give you tips that will help you as a pregnant woman and so forth and so on and so forth. Why can't we do this for other disease conditions? Why can't you think of diabetic patients, creating a group for them, hypertensive patients, osteoarthritic patients, and so on and so forth? Why are we limited? Okay? Then, physiotherapy networking services. People are doing networking, even in the crudest way. Think of Uber, think of OPay. All these things are physiotherapy service, networking service. All these things are networking services. You need a cab, you call, you just place a call, or you type something, and then one comes to your doorstep. Why are we still living in crude forms? Hey, are you in Aba today? I have a client in Aba. Can you see him? No, I'm not in Aba. Let me call somebody else. And we keep putting up these things on our platforms. Any PT in Ilorin, I have a client. See, I'm happy. I'm happy with the call a physio guy and some other one that I just saw recently. These are the things we should be doing. Most of us have knowledge of ICT, but we're not utilizing them. Set up networking services. All these OPay, Uber, and so on and so forth. That's how they are making money. Okay, you don't need to call 10,000 people to get a physiotherapist. Okay, people should start marketing themselves in your network. You will make a lot of money from that. Mentorship mentee services. We are not into mentorship mentee services, but it's a money-making venture, even abroad. A lot of people are making money from this. You just create, you go online, you see many websites. They'll ask you if you want to be a mentor, or if you are looking for a mentee, or one thing or the other. And people start paying you for that, okay? We can go into this, especially the senior ones or the more experienced ones in the profession. Someone is saying networking services, boom. Yes, so try it and see what will happen. Opportunities for physiotherapy entrepreneurs continued. Training programs, interprofessional socialization. So someone said we do seminars and workshops. Very good. Charity said that. We do this, but we need to step up with what we're doing. Most times, we only do seminars and workshops for our profession, okay? So we can step out. You can start organizing seminars and workshops for people that are not even in your profession. It mustn't be a paid training. It can be a free one. If it's a free one, see, okay, let me give you a typical example. I got the contact of a urologist 2 weeks ago. I sent him a message. I told him, I'm a women's health physiotherapist, and we also manage men's pelvic health. He was like, what business do I have with this woman? I told him, when are you having your next conference? I want us to collaborate. I want to come and do some presentations in your practice. I want to come and do some presentations to urologists. He got interested. Okay, after the lockdown, we'll talk better. See, what am I telling you? If I go to the urology unit to do a presentation, they're not paying me. But I bet you, after that presentation, they'll start calling me. If they have clients with erectile dysfunction, if they have clients that are going in for prostatectomy, they'll call me. Because I've come there to blow my trumpets, okay? When they have referrals, they'll refer them to you. They won't think of any other person, apart from you that came to their presence to blow your trumpet. And before you know what's happening, you invite them to come and do a presentation for you, and just that way. You can do presentations for government or private organizations. Like I said, if you get involved in occupational health, you can do presentations for these people. I can remember when I finished youth service, some group of physiotherapists in Abuja, used to call me then. We used to go and do presentations in some private organizations. We were teaching them economics, but it didn't last. I don't know what happened again. Okay, most times if you thrive in these things, before you know what's happening, many people will request your complimentary card. Many people will want to get into business with you. Business is not just treating patients, flexion and extension. They want to do something more with you, okay? You can go into health promotion. I'm going to have another training on health promotion. Most of us have ideas, but we don't know how to give out ideas. Most of us don't even have ideas to promote. So what am I saying? You can go into health promotion at professional levels and at community levels. At community levels, you can look for a group of people and present one thing or the other to them. Let me tell you, you cannot do a presentation for a group of persons without getting people's phone numbers, without people request. In fact, you'll be a hot cake that day. I can remember last December, we went to do some health talk, okay, in Radio Nigeria. I presented something on false prevention with my team. Hey, in fact, that day, they didn't want us to go. They kept collecting phone numbers and so on and so forth. Before you know what's happening, you will get a lot of clients. Will you tell me that you need a doctor to do that one? If that person calls you and comes to your clinic, will you say that, since it's not the doctor that referred him or her, I won't see him? No. You're already selling yourself by doing health promotion. How many of you have thought of going to the churches, going to August meetings, going to places where women do their meetings, in marketplaces, to reach out to women, to tell them what happens at menopause, to tell them that they may be at risk of osteoarthritis or osteoporosis? Before you know what's happening, they'll start chasing you up and down. How many of you have, in fact, oh my God, there are a lot of opportunities. You just need to see them coming, okay? Involvement in school services. School, if you don't have a school now, now wow, I don't know. In fact, in Enugu here, every street has a school or two or three, and it's the same everywhere. You see school, wahala. School needs a lot. In fact, there's a lot of competition in the educational industry now. They want something that will make them better than another school. Every school owner wants something that will bring him or her into limelight. I told one of my MSc students, she's into sports therapy. And I told her that, see, I don't want old stories. We're not going to do traditional things in this course. Just go and do a survey and tell me how physiotherapists are involved in school services. Every school has sports activities once in a week or 2 times in a week. Every school holds inter-house sports. Every school, some schools have dispensary or medical centers. In fact, schools, they do a lot of things. I want to see how involved we are in school services. Let's start from there. Let's take it from that point, okay? All these things, we're not involved in them. I want to tell you, most of them don't know who we are. There's one man that has a very large networking business in Nigeria. What he does is that he hosts trainings for school owners. He has a lot of online platforms. If you're a school owner and you're not on his platform, you're wasting time. I wrote him a message about 2 weeks ago because of that, my MSc students work. I told him, we want to do a survey. Can we use your platform? I was even telling him we are physiotherapists, what we do, our relevance in the school system. He didn't even know what I was talking about because we are not relevant in that field. What stops you from going there? Get involved in their sports activities. Train their teachers. Do you know that some years ago, 2 years ago, we did some study on teaching board height. We tried to determine appropriate teaching board height for individuals based on their standing heights, okay? And we made significant, we had significant findings from that study. I can remember telling those 2 students that did those works, I told them, don't allow this work to end here. Take it up, take it to Ministry of Education. Tell them that you want to organize training for teachers. Teachers are suffering. You come to the classroom, you see a blackboard or a whiteboard fixed on the wall. Whether you are short or you are tall, that board is already fixed. You have to write on that board like that. Organize trainings for them. Organize trainings for students. How to hold pencils, how to sit in a class. Let's evaluate your tables and chairs. Let's do this. Let's give you ergonomic advice. You know that when you do these things, a school will use you to blow their trumpets. They'll start telling parents, yes, we have ergonomists, we do this, we do that, you know, all these things. They'll want to use you to blow trumpets. And they're also using you to sell their school while you are using them to sell yourself. Schools organize events. If they're not doing a party, they're doing graduation. Have you ever thought of going to a school event to sell yourself? Who do you see in school events? You see parents, okay? For those of us in women's health, have you ever thought of going to a school event? Because it's difficult for you to come to a school event without seeing young mothers, without seeing pregnant women. Have you gone there to do a presentation? Have you gone there to say something about pediatric health? Okay, so that they keep calling you. We're not doing all these things. I encourage you to start tapping into school services. Okay, educational resources. You can start organizing short courses, short workshops, short videos, view and end videos. Start writing books. Okay, I know that. Okay, there's one woman. I use her exercise videos for my daily workout. One Leslie Sanson. That woman is very popular. If you go to her YouTube channel, you see more than how many million viewers, how many subscribers. Why can't we be like her? What is the difference between those people and you? Okay, can't you organize things like that and then create for you to create a YouTube channel? You don't need to pay money. It's for free. You can see people are making money from view and end videos. They'll stay in their house. Their husband will be snapping them. They'll talk one rubbish, blah, 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 blah. They'll post it online and we keep laughing. We watch Emanuela, we watch all of them. People are making money from the digital industry. Why can't you tap into these things? Make some short videos, create a YouTube channel. People keep watching. Before you know what's happening, it becomes an e-commerce channel and so on and so forth. How many of you have thought of writing pamphlets? You can write a pamphlet. You go to antenatal, okay, let me give you a typical example. When you go to an antenatal clinic, you see people coming there to sell Zobo, to sell mineral, to sell bonds. Why? Because they know that these people will buy. Have you targeted an occupation, a particular group of people? Have you written a pamphlet on posture in pregnancy and nobody bought it from you? Have you written a pamphlet on false prevention? You take it to a place where you know that a pension office, where you know that pensioners come every time. At the beginning of the month, they'll come there to lay complaints and you start selling it to them. Do you think they won't buy? Maybe you sell it for 150 before you know what's happening, turnover. Have you written ebooks and nobody is buying it from you? Just last week, a few days ago, I bought an ebook for 5,000. After reading that book, I wanted to go and collect it. I don't even know the person that sold it to me. All I know is that I saw an advert and I put in my account details and bought a book. I felt like saying, please give me my money back. People sell rubbish and they do rubbish and they make money from it. Talk more of you that can do something meaningful. Okay, we can go into educational resources and it will help us a lot. Environmental management, disaster management. In Nigeria, we are nowhere close to disaster management. Last year, one of my students did a study on disaster management. He presented it in a conference in Port Harcourt. I told him, it shouldn't end here. Oh. Take this thing, take it far. Go and look for the ministry in charge of disaster management. Sell your ideas to them. Sell your findings to them. Before you know what's happening, they'll start calling you. Tell them you want to train some people in NEMA. Tell them you want physiotherapists to get involved in NEMA and so on and so forth. Before you know what's happening, they'll start calling you. Disasters are everywhere. You don't even see disasters today, but you're sure that there will be a disaster tomorrow. Okay, we need to get involved in these things. Okay, don't do your studies and put them under the table. Specialized pediatric services. What are we doing in specialized pediatric services? For physically challenged infants, we can get involved, okay? We can also, you know that deaf and dumb children have a lot to benefit from physiotherapists, but we're not tapping into them. Geriatric services, we can get involved in geriatric services. We can also partner with existing practices. Okay, there are arthroplasty teams here and there. There are fertility teams everywhere. And they don't have physiotherapists in their teams, especially the private teams. You can get involved with these people. Research-related services. How many of us are into research services? You can be a research assistant to some persons, okay? Or someone said my class is almost more than 90 minutes. Actually, this class was supposed to be a 2-hour class, okay? So we still have time. Then research-related services. Research-related services can earn you some money. If you are a research assistant, you can make money. I'm sorry if I don't explain these things in details. People will not gain the knowledge that I want to share, okay? Government-sponsored community-based services, very important. I've talked about community support or community programs. I won't repeat them again, okay? Rehabilitation homes and recovery centers. I'll give you a typical example. Last year, we wanted to celebrate the World Disability Day, and we went to a ministry in this state that was responsible for managing all the rehabilitation homes and recovery centers. And we told them we were physiotherapists. The commissioner there didn't even know who we are. And I told her that we want to get involved in the World Disability Day. They couldn't place a connection with what we were saying, okay? So, in fact, at a point, we had to forget about them. So rehabilitation homes and recovery centers are not even getting our services. You can imagine a commissioner of a ministry in charge of rehabilitation homes and recovery centers saying she doesn't know who a physiotherapist is. I'm sorry. Now what? Another thing is sales and maintenance services. Very, very good. Most of us are into sales and maintenance services, okay? But we need to step up. Don't just depend on selling only infrared antennas and your colleagues are buying from you. If they don't buy from you, that means you are not making any sales for that day. Don't be selling only electrodes. There are some other things you can sell, that's consumables that our patients need, okay? I'm not saying you should start selling physiotherapy equipment to patients, so no. Those things you are selling, have you thought of marketing them digitally? Or you are just sitting down in your physiotherapy department selling them there? My dear, you are limited. You are just a private practitioner. You are not an entrepreneur. How do we create niches for ourselves? I've listed some opportunities. It is one, for you to grab an opportunity. Another thing is to create a niche for yourself. Before you create a niche for yourself, I want you to ask yourself one question. Okay, Dr. Odole, sorry, Mao, but we still have more time. So, creating a niche for yourself, be a big fish in a small river, and not a small fish in a big river. See, most of us are small fish, most of us want to be small fishes in big rivers. When you are a small fish in a big river, tell me who will notice you. Nobody. Try to be a big fish in a small river, and that's the game. Look for untapped areas and start creating new niches, okay? Generate an idea. If you generate an idea, okay, you want to create a new niche for yourself, the first thing you should do is to generate an idea. If you generate an idea, then you ask yourself another question. What type of physiotherapy services do I want to render? Okay, is it preventive? Is it management? Or do I want to go into specialty practices? Of course, everybody needs to go into specialty practice. Okay, preventive and management. Preventive is different from management. Which one do you prefer? You have to ask yourself this question. Okay, if you create some people are into preventive services, like those people that have fitness gyms. Most of them are into preventive services. Okay, think of what you want to do and tap into that niche. Who are your ideal clients? Ask yourself this question. Am I just generating an idea that is unrealistic? If you create a niche, ask yourself, who are my ideal clients? If you live in a city or you live in an area where you have a lot of geriatric patients and you are thinking of setting up a pediatric practice, I don't think you make a lot of money from that, okay? So your ideal clients should also be affected by your environment. Then ask yourself if you have the necessary knowledge and practice and experience. If you don't have the necessary knowledge, you are wasting time, my dear, okay? You can create that new niche, but you will not survive in that niche. So you need knowledge and you need experiences. What are physiotherapists already doing in such a niche? It may not be entirely new. Some people may have been in that practice. You have to find out how successful they are. You have to do smaller proco. Find out what their failures were. How did they fail in that niche? If you find out their failures, you tap into their failures and enhance on them. Creating a niche in an existing practice is another thing. It mustn't be a new niche. It mustn't be a new practice, okay? You can create a niche in a practice that is already existing. Provide exceptional physiotherapy care. If others are using traditional methods, look for new evidence-based methods that will give you faster outcomes. Look for methods that will make your therapy sessions more interesting, okay? Before you know what's happening, more people will come to you. Customize your environment. You can decide to customize your environment. When you customize your environment, it attracts people to you. People love what they see, okay? Think of changing your billing system. That's another thing. If every other person in your location is billing per month or per 3 months, you can change your billing system and attract some persons to you. You can change the way you handle appointments, okay? That means creating a niche for yourself. You can decide to integrate group sessions in practice, interactive sessions. How many of you have come up with flyers, spread them out online and tell people, we are organizing an interactive session for diabetic patients. It's a free session. Just come to so clinic. Just come and learn. Before you know what's happening, they come for those interactive sessions or those group sessions. And before you know what's happening, they're there, okay? Friendly staff team. Friendly staff team is another thing. You can decide to change your administrative services, okay? But that way you can create a niche. Remember what happens when you go to a clinic or when you go to a hospital and the staff team is overly friendly. You want to stick to them. You even want to keep going there, even when you are not having any sickness. You want to go back to them. Quality advice and information. Quality advice and information is another thing you can do to create a niche in practice. Do your clients just come there, receive treatment and go? How much information do you offer them? Okay, are you into expert online resources? You see those of us that are into telehealth. You see those of us that made innovations last year and so on and so forth. Okay, I know some team, Dr. Dole and Co, they had this telehealth something for osteoarthritic patients. Are you trying to tell me that in this COVID-19 period, they will bother with their patients? They will not. You use those things and manage your patients. Some of us are thriving now in COVID-19 period because we have expert online resources, okay? How many of you have good welfare support for your clients? I can remember when I had a business center and it was quite competitive around there. What did I do? I bought a freezer. I started chilling water and I was telling people, I put up a poster there, quench your thirst for free. I started having plenty customers because of 5 naira pure water. Do you know that some women can register for antenatal in a clinic just because when they come for antenatal classes, they give them one moi or they give them pure water? You are attracting people to you. Learn to do giveaways. And this is what MTN does, Glow, and so on and so forth. They do giveaways to attract you to them. Don't think that giveaways are for people that sell things in the market or for people in telecommunication. It's for everybody, okay? Learn to follow up your clients. Create new follow-up principles. Follow-up principles can be by way of sending them reminders to do their home programs and so on and so forth. Create a niche. Look for something that will make you exceptional in practice. Be an expert. Specialize. If you don't specialize, if you're not a specialist, you are dulling. Okay? What am I trying to say? If you specialize, you are creating a niche. Once I think of, I need this person, I'll think of you and I'll call you. Don't be a shadow, okay, in the profession. Make an impact. Gain more knowledge, professionally and otherwise. Stop waiting for people to teach you. Nobody has time to teach you everything. Develop yourself. I know some of you got onto Zoom for the first time today. Did anybody teach you? You have to educate yourself. Educate yourself on even things that are not professional. Okay, maybe like I gave you example of some skills. These skills, you can develop them. Network with other practitioners. I've mentioned this before. Okay, stop waiting. Stop, let's stop grumbling and saying that marginalization, in as much as there's marginalization, are we going to keep complaining about it? No. Network with other people. Make some noise with your capabilities. I always tell my students, if you are managing a patient, manage that patient as if you are going to do a case presentation. Document everything. And at the end of the day, make sure you present your cases, okay, in interprofessional seminars. You don't manage a patient and you keep the folder. You are not making noise. How am I going to know that you were able to manage that patient? Okay, come online and make some noise. Do you think it's only people that sell clothes and all that should be making noise online? No. Make noise with your capabilities, okay? Another thing is that you should get mentors and mentees. Even if people around you are not good mentors, look for mentors. I had a mentor for so many years. I didn't know him in person. Dr. Mbada from the West. He was my research mentor. Okay? In fact, for every paper I write, I'll send it to him. He will read it, but we never met. We only met for the first time last October. And when I walked up to him to introduce myself in a conference, he didn't even know. He said, I don't know you. I told him I'm Chidiebele Ojukwu, and he was surprised. So if you don't have mentors in your areas, look for them everywhere. Okay, I have mentors that are not in my area. You also look for mentees, people you should mentor. Even if you are an intern, let me tell you, there are people you can mentor as small as you are. And when you have mentees, they challenge you. But if you are just there, you think you are an organ, you don't learn. But when you have people that you are teaching, they challenge you to learn more. Then the in thing now is digital marketing. Everybody is going into digital marketing. Try to be available online. If you are available online, you start advertising your business beyond your reach. You will advertise your practice beyond your reach. You don't just put up a billboard, so physiotherapy clinic, and you stay there waiting. Who are you waiting for? So if nobody comes, you don't have clients. You can have clients from all over the world. When you are advertising your business, be detailed and specific in your adverts, okay? Most of us, we just write physiotherapy services. We care. You care. What do you care about? What is it that you are telling them that you are doing? You are not even specific. A physiotherapist keeps you moving. It's not enough. When they see keeps you moving, well, it's not even passing any message. So you need to be detailed. If you go online and you go to international, some websites, you will see how they market themselves. They will tell you, do you have osteoarthritis? If you have osteoarthritis, you may feel this or you may feel that. You know, come for this or come for that. Okay, so let's be more detailed and specific. Establish marketing strategies for different populations. If you want to reach out to geriatrics and you are posting your flyers or whatever on Facebook, hey, you won't see them. Oh, go and look for them. There are places where you will see them. So for every population, there is somewhere that you will see them. If you are also using digital marketing platforms, you think of, okay, who am I targeting? If I'm targeting young people, okay, I can do my advert on Facebook, on Twitter, on Instagram. If I'm targeting old people, I can do my advert on Google, on Bing, because most of them use Google or Bing. Okay, these are things you should consider. You don't just write it on your WhatsApp status and you think it's enough. No. It's not only people that are selling clothes and shoes and hair that should be doing digital marketing. Go into digital marketing. When you are doing campaigns online, use trigger words. For example, tell people, get smarter with our aerobic exercises, or get stronger muscles with our strength training programs. You know, things like this. Or we can teach you convenient ways of working without pain. You know, these things are trigger words. They stick. Use action words also. Call us, learn more, sign up, enroll, schedule an appointment. Okay, it's not where you don't put up an advert after telling them so physiotherapy clinic and it ends there. No, put action words that we call them to action. Identify international celebration days. If you are able to identify international celebration days, it will help you to create a niche in this profession. Don't make noise only on World Physiotherapy Day. There are so many things you can, in fact, there are so many things you can celebrate. And for every celebration, okay, there is something, find a way to fix yourself and market yourself. In the last International Women's Health Day, our Women's Health group, we tapped into it. We started talking to women about equality in sexual practices. And before you know what's happening, many of them were calling us, wow, oh really? So women's health physiotherapists, what do you do? I am having sexual dysfunction, and so on and so forth, okay? So if you are not able to identify some international celebration days, you cannot create a niche. You should also be accessible. Okay, remember what happens when you have a doctor or a clinician that you cannot access. Okay, Dr. Dole, I will unmute you. Thank you. Be easily accessible. Okay, don't be a practitioner that people cannot reach you. You should also learn to build client trust. Build client trust when you have strong values. I won't talk about values again. I've talked about them before. Develop other skills. Time management skills, negotiation skills, health promotion skills, financial management, and so on and so forth. You have a lot of trainings online. You have a lot of free trainings that you don't even need to pay for. Information is everywhere. Develop yourself so that you can create a niche. Learn business evaluation and performance appraisal skills. If you cannot appraise your practice, you are not doing very well. You need to look back and see how far you've gone and where you are going to, okay? I'm not sure I've done justice to this topic, but with the little I have said, well, I want to believe that it will encourage us, it will spur our interest in getting into physiotherapy entrepreneurship. It will help us to want to get into private practice. It will help us to become more innovative. It will help us to stop being private practitioners only, to start thinking like entrepreneurs, to get innovative, to get creative, to paint this profession and come into limelight. Thank you. I'm going to unmute. You can type in your questions into the chat room. I will unmute. Dr. Dole said she wants to say something. Okay. Thank you. If you want me to unmute you, let me know. Hey. Okay. Dr. Dole, you can talk to us. We are listening. Hello.
Hello.
Yes, you can have a recorded version. Dr. Dole, good evening.
I'm actually editing. Good evening. Thank you so much, Ojukwu. That was well said. That was a good delivery, even though you didn't have as much time as you wanted. Yes, I just want to say something about being that big fish. You know, it is a process, so it is not something that you just get to be a single day. For the younger ones, I want you to make sure that you develop yourself. Identify those areas that you're interested in, and then develop yourself in those areas. It is not easy to become a big fish. What Dr. Ojukwu has just told us, I'm sure she has so many experiences to share with us. It didn't just start in one day. Probably it started even when she was an undergraduate. So I just want to encourage us, we can get there. It is just taking that step, just having that mind to take that step of developing yourselves. Thank you.
Okay, thank you, ma. Thank you, ma. Does any other person want me to unmute him or her? If you want to say something, just let me know. I will unmute you. Dr. Odole, thank you very much. She's trying to tell us that we should develop ourselves. If you don't develop yourselves, you are going nowhere, my dear. Okay? The undergraduate knowledge you got is not enough. We keep learning every day. So can we have more comments from the house? Can we have more comments, questions? Type into the chat room, okay? What are the possible ways of getting grants? Wow. Anyway, getting grants is a topic of its own. Should I say that, what kind of grants are you talking about? Techno, what kind of grants? Is it grants for research or grants for business? Someone is saying, how can physiotherapists access startup funds to help establish uncharted areas? Hey, now wow. In fact, I really think there are a lot of places you can seek funds from. But what happens? See, let me tell you, there are these people that lend money online. Oh, but if you're not very sure of what you are doing, don't go and borrow money, oh, so that you don't have tachycardia. Like I told you, if you can borrow some, see, there are people that pop up on our phones now. They tell you borrow this amount. They're everywhere now. Fair Money, Carbon, Branch, they give any amount you want. Okay, I know many people that are utilizing them. So I encourage you to look into these areas. Like someone added me to a group about 2 days ago, and they said it's ECOWAS for female entrepreneurs. I didn't even know something like that was in existence, okay? So just find a way. I don't know, I may not have all the knowledge on that, but find, search online. There are many of them that can help you with soft loans to start up a small business. And then it's not all about getting loans, okay? If you get loan, will you know how to maintain it so that you don't put yourself into big gbese? Okay, so when you are going for loan, you're not going for loan to start paying school fees. Oh, if it is for business, use it for business. But then you must have done your feasibility studies so well. Okay, someone said that physiotherapists are not regarded as doctors. Only is this one your problem now? Regarding us as doctors. See, let me tell you. When you came, see, these things are not my problem in the profession, really. Wherever you are, create a niche. What you can do, a doctor cannot do. There are some things a doctor can do that, in fact, we are all different professionally. So why do we keep struggling for someone? If you want to put doctor in your name, go and do a DPT, go and do a PhD, but it doesn't end there. Even if there is a doctor in your name and you don't have the sauce, you don't have the onions, my dear, what does it benefit you? There are so many doctors that don't even know what they're doing. There are many misters and misses that know what they're doing. And when they pass, you can't help but to notice them. I think we should start thinking beyond this, okay? It's not all about doctor. And that's why some of us go about parading ourselves as doctor this, doctor that. Even, see, forget these names, they're nothing. Okay, that's my opinion. Doctor will not put cash in your pocket. Oh, yes, so what matters most is money for pocket, and that's the most important thing, or what you have been able to achieve. How many people know you internationally? That's what you should be thinking of, and not who calls you a doctor. So only, I encourage you to do more than those people that are even answering doctors while you are preparing to be a doctor too. Okay. Any other question? Okay, people are responding to all these comments. Olio, read it up. Emily, you are raising up your hand. Do you want to say something? Someone said, what are the other places where we can get good training from? Maybe online. You can get a lot of training online, okay? See, there are so many trainings. In fact, there are even people that organize webinars not just for physiotherapy profession, in a lot of, the only thing is to know them. And see, sometimes when you are browsing, you will see some pop-ups that will tell you, do you want to keep getting notifications from us? Always drop your email addresses. You will get notifications, especially for those of them that organize training. Some webinars are free, some are paid for, but I think most of them are free, okay? Before you know what's happening, and then when you also have mentors, like I have a big mentor, Dr. Odole, she's always sending us one thing or the other for webinars, for this, for that. And once she sends to me, I'll send to my own mentees, okay? So you need to have mentors. You need to, associate with people that know better than you, and they'll tell you the way forward. Someone said I should give her the names of good sites that I may know for physiotherapy. Hey, this one may require critical thinking. I have to think before I provide this answer now, because now what I'm thinking of is entrepreneurship. I can drop my number on this platform, okay? Please, let's chat later about this. I can't think them up now, okay? But if anybody knows, please feel free to give her the information. Ebuka Ezike, you said you want me to unmute you. Okay, you want to add something. Okay, let me look for you. Okay. Okay, Ebuka, the floor is open for you.
Hello, good evening, Ma. And good evening, house.
Good evening, Ebuka.
Okay, so I have something to add regarding how to get money, to maybe start up. There are lots of physiotherapists that actually started up by partnering with other people. For example, it depends on what you have in mind. At times you can partner with, let's say, some of the big patients that you attended to. This is like business. Physiotherapy is like business. So you have to have that eye to actually find out, someone that you think will want to venture into health business. In the sense that after managing that person, you can pitch your idea, or even when you're managing the rich individual or wealthy individual, you can pitch your idea to the person. If the person is interested, you can write proposal telling the person how you want to go about, opening a physiotherapy center or whatever you want to open for the person, and tell the person how he or she is going to gain from whatever you want to offer to him or her. Because I know a lot of people, that actually started out by partnering with some of wealthy individuals in our society. They used them to make name for themselves. And after that, if it doesn't work out, you've already made name for yourself, you've already stood out, so you can now stand on your own. So I think it's actually a great way to acquire funds, not just going for me, I don't really subscribe to obtaining loans from all these money lenders, because it's usually crazy. By the time they will start billing you, you see that you end up going home with one kobo. So it's better for you to partner with somebody. Let's say, okay, you tell the person, I'll be getting something like 100,000 naira for you every month, or 250,000 naira for you every month. Then people will have an agreement, a signed agreement, and you even have a legal binding, that is signed by a lawyer, to make sure that both of you keep to the terms of the agreement. So basically, I think that's, for me, that's the major way you can actually acquire funds, by, meeting those individuals around you, or some of the patients that you managed in the past that you think, could have an interest to actually venture into a physiotherapy business. So pitch your idea to the person, and if the person is interested, the person will, help you set up the business, and then you can have a deal of how much or whatever you're going to be giving to him or her at every month. That will really help you to start up. Thank you very much.
Okay. All right. Thank you, Ebuka. Okay, I'll meet you. Someone said she wants to share something. Ogechi said that in primary health centers, they don't recognize physiotherapists. And even when she tried to get involved, the doctor told her she doesn't have anything to offer. Wow. Anyway, that's Nigeria for you. But that was why I talked about negotiation. Okay, okay, it's not Ogechi that asked this question, it's Chidimma. Chidimma, how much negotiation did you get into? Maybe you didn't push well, okay? Did you, in fact, see, there are many ways to kill a rat. If they say you can't come, if they say you can't get involved through this end, you get involved through another end, okay? Just find a way. Before you know what's happening, you will create a niche, okay? Ebuka, thank you very much for that comment. In fact, I really know many physiotherapists that started working in collaboration with their patients. Although most of us are in rural areas where we are not opportune to see rich patients, okay? But I really pray that even those of them that are not very rich, some people may not be very rich to want to get into business, okay? Dr. Odole is saying that you can collaborate with colleagues of like minds. Sometimes if you don't have enough money, you collaborate with other people. If you collaborate with others, yes, it makes it easier, okay? How do you collaborate with your colleagues? You can collaborate with your colleagues when you find out those that have special interests. In fact, do you know that sometimes I've seen people put up something on platforms, like in my university, on our college platform. I've seen some people putting up something like, are you interested in pediatric research? Are you interested in women's health? Private chat me. How many of us put up things like that? Who is interested in this? Who is interested in that? Sometimes when you publicize your interest, people will come looking for you. But what happens is that we bottle up our ideas. We bottle up our dreams because we don't want people to share. Me, I'm not afraid of sharing my dreams with anybody, because if you are not meant to take that dream, you cannot take it, okay? If you have a dream, look for people. You are not the only one thinking about that thing. There are other people, okay? Look for them, collaborate with them, write an MOU, generate an understanding. Everybody will have a role to play, and before you know what's happening, you are there, okay? Somebody said a closed mouth is a closed destiny. Now, so you keep hiding behind the wall like that lady I showed you, okay? Techno, you said you asked a question I didn't attend to. What's that question? Okay, someone said Union Diagnosis is not owned by one person. Exactly. Doctors and other people, they do a lot of collaboration, a lot, okay? Some of them don't have the money to set up a clinic on their own. Okay, okay. What is MOU? Oh, thank you. Charity has answered that. Memorandum of Understanding. These are the things you need to know when you become an entrepreneur. Okay, you don't just go into business with anybody because he's your father or your mother or your uncle. No. Before you go into business, oh my God, you need to know, you need to have an understanding with that person. Okay. Chidima said I should unmute her. Okay, I will. Someone said, can I? Yes, I am recording this class, okay? I'll send them out by next week. Or maybe when because I have another class tomorrow, I'll send them out. I'll send it out, don't worry. I have your email addresses, okay? Any other question? Let me unmute Uzoechi Chidimma. She wants to share something. Please, we want to hear from some of us. This is an interactive session. We can only learn from one another. No man is an island, okay? Oh, I unmute the wrong person. 1 minute, oh, sorry. Please, I want to see more questions in the chat room. Uzoechi, you have the floor.
All right. Good evening, ma. Good evening, everyone on the platform. It's actually a very interesting class, and I really enjoyed every bit of it. Thank you, ma, for everything you said, because it reminds me of my efforts, what I've been trying to do after my service. I finished service last year, so currently I'm in Lagos, and I've been looking for job, work. Anyway, what I actually wanted is to be independent, To be independent doesn't mean I want to be alone, but I want to have a job of my own. I don't want to work. I don't want to go out there looking for work because I know what it means in Nigeria, and getting government job is not also an easy one. So when I got to Lagos, I tried out so many places for work. I wasn't getting any. So at the time, I wasn't doing anything. I was just in the house. So I thought of what to do. Okay, maybe I should just volunteer. That was when I started going to places. I went to some private clinics. I submitted proposals. I submitted my CV. I wasn't getting any call. So I just traced a nearby health center in my area, and I went there. So I got to the health center. I introduced myself. I asked to see the head there. So they directed me to a doctor. So when I met him, he's a man. So I now introduced myself to him, told him that initially I don't want to tell them I'm looking for a job or something. So I just told them that I came to see if they have a physiotherapist in the health center, and if they don't, that I would like to at least volunteer, render physiotherapy services to the patients. So the doctor now told me that this is a health center, that they don't do much, they have few patients, that they don't specialize, they are not specialties here, that they just treat patients with malaria, they just give them drugs and send them back home. That serious cases that would need physiotherapy, they normally refer them out. So that I may not really be relevant. At that point, I didn't know what else to say again. So I said, okay, but in case if there's any patient, or if in the future they start having one, that he can contact me. So I leave him with my contact. Then I left. But then recently, I'm beginning to think. I just learned that they run antenatal classes for their pregnant. So I'm also thinking of going back there to see if I can actually take up antenatal classes, physiotherapy, what physiotherapy can offer to the antenatal women there, to see how it will also go. And I hope this one will yield something better. Though I don't have something that I'm doing, but I feel I can still offer something up there. So, but that is by the way. But I also want to share something with us. This one is different, and it happened before I went for my internship. I did my internship at Amido Kano Teaching Hospital. So shortly before I went for my internship, my mother has stroke. So, but luckily for her, it's monoparesis. So I managed her before leaving. My mother and my dad, they stay in my hometown. So it made me to spend time in my hometown. And that was when I discovered so many things that were happening in the villages. Most of them there suffer stroke on daily basis. And they don't have anybody to turn to. So they just patronize the traditional bone setters. So while I was there, about three persons that visited my mom suffered stroke within that period. Then when I asked where they were, because I wanted to go and see them, I was told that they were rushed to a traditional man, not even a traditional bone setter, a traditional man. So now learned that was the order of the day. And this man in question, I don't know him, and I didn't go out to reach him. But I learned that the man charges them.
Hello.
Only.
Network is bad. Can you hear me?
Yes, I can hear you.
Okay. Just round off in the next 1 minute.
Okay,
Round off in the next 1 minute. Or we
Okay,
will do some of these discussions on a private chat. Okay, but I have two questions for you. That clinic you've been going to, is that the only clinic in Lagos?
No, ma. I've also gone to different other places too. It's not just one place. I've gone to several hospitals. Okay, initially when I came to Lagos, I was just submitting my CV. So when I didn't see any call, so I now changed my pattern. I started writing proposals. I want to partner with the hospitals, some that doesn't have physiotherapy outpatients. I want to partner. I want to be the physiotherapist on call. Finally, I got two, but the only challenge now is that most times they are not having patients that need physiotherapy. But I got two different hospitals that have their physiotherapists.
Probably because you're only thinking of patient management. There are other things you can do. We mentioned, okay, patients are not our only targets. Like I told you, everybody is a target for physiotherapy. So stop depending on only patients that need medical care. Okay, widen your horizon. You said something about getting into women's health. Very good. Do you have the necessary experience? If you don't, take out some time, develop yourself before you go into it, okay? Any field you want to go into, develop yourself. When I mean developing yourself, you mustn't have a master's or a PhD degree. No, that's not what I'm talking of, okay? There are specialty trainings you can go for, okay? There are certified trainings you can go for, okay? For you to be a specialist, and then you need to gain some experience. You can consider working under someone who is a women's health physiotherapist before you delve into that field. Look for a mentor. If you have a mentor, you will thrive better. An honest mentor, okay? Not someone that hoards information from you. So reach out to more hospitals. I encourage your efforts. I even see them online. But I think most times you just put your advert on WhatsApp and that's all. You've not really gone far into digital marketing. Okay, change your CV, change those your flyers. It's not just enough. I've told you, use trigger words, use action words, tell people what you do, make more noise, and definitely you will get there. I encourage you. Let me mute you. Okay, your environment is a bit noisy. Thank you. Obonna Chidima is asking a question. She said, from my experience so far, thank you. Chidima, I will chat later. The senior ones used to say you must have about 10 years of experience before opening a clinic. And I replied someone now, is it only opening clinics that we talked about today? There are so many things I've told you now. It's not only to open clinic. If MRTB regulation says you cannot open clinic, will you sit down and wait for the next 10 years? I don't know, if I'm not sure it's 10 years old. Please, another thing is that most of us don't have the right information. If you are well informed, it will help you. MRTB is not in America. You can call someone, ask them, seek information, okay? I don't think it's 10 years. But even if it is, there are other things you can do. The sky is just our starting point. Any other? Okay, please, can we get trainings on digital marketing? Anyway, I'm not an expert in digital marketing, but I've attended quite some trainings on digital marketing, and I'm still attending more. Because apart from physiotherapy, I also do my own private business, okay, which is not related to my profession. So I attend a lot of trainings on digital marketing. I can direct you to some of them, okay? So if you're interested, you just chat me up. I'll give you the person that trained me in January. She was very, very good. And there are some of them that offer free trainings on digital marketing. I attend their webinars and so on as once in a while. So if you want that, you'll get their contacts. For those I know, there may be others. Techno, yes, so I'm making sense. You too, you're making sense too. I like your questions. There are online courses on digital marketing. Any other question? If I didn't attend to your question, please call me back. Charity, okay, let me unmute you. Charity, you have the floor.
Hello.
Hello, good evening.
Hola, good evening.
Well done.
Good evening, everyone.
Good
Please,
evening.
my name is Charity Ojukwu. Chidimma's contribution actually struck a chord on me because I can say and attest to volunteering as very, very important. Is a way of getting clients, volunteering and community services, like you said. Because personally, I have an experience with working as an NGO founder. And I know through NGOs, you can actually get a lot of clients. Personally, I run an NGO on sickle cell, and I know I have a so lot of clients, sickle cell clients, through that NGO. And that NGO has really taken me to places even more than physiotherapy. And if sickle cell is actually my physiotherapy dream, I know, I see a whole lot of patients. What am I saying? That volunteering, doing a lot of community services is a way of attracting a lot of clients. Because if you have services you render to people, as you're rendering these services free, when they now have a need, because most times everything is not money. Like this webinar we are on here, I'm happy I've got and I've learned so much, and it is free. Can you imagine that? It's free. Tomorrow now, if Dr. Chidiebele presents something or advertises something that is for money, personally, I know I'll be interested because she has given services free before. And you'll be interested, and because it is free, people now see your capabilities, people see what you can do. Then they are willing to pay for such services. That is my little contribution. Thank you.
Thank you. Thank you very much. Yes, Chidimma, I also want to encourage you to be patient. See, you said you just finished serving last year, and you're already sounding like you want to give up. Don't give up. I mentioned it. An entrepreneur doesn't give up easily. Okay? You have to keep pushing on until you get there. So if you push this way and it doesn't work, go back, re-strategize, prepare yourself, and come out again. Okay, Charity, thank you very, very much for this wonderful comment. Obonna Chidimma, thank you. Nice lecture. Yes, thank you. Any other? If I have 5 people, or okay, if I have 10 people, type none into the chat room. I'll stop. I'll end the class. That means we don't have comments or questions anymore. If 10 people, okay, Ebere is saying, how do we get a mentor? Hey, it depends on the kind of mentorship you are looking for anyway. If you want someone to mentor you on making money, then you go and look for a rich man or something who is willing to share knowledge. If you want to gain mentorship, for example, in women's health, you can start looking for a women's health specialist. If you want to gain mentorship on entrepreneur, depending on what you want, okay? So Ebere, if you can get more specific, I can answer your question better. So it depends on what you are looking for. I have many mentors for different purposes, okay? There are some people that are your mentors for family matters. There are some people that are your mentors for religious matters. There are some people that are your mentors in the profession. They encourage you to read. In fact, I know that there are some people that I'm beginning to be a pain in their asses, because for every knowledge I gain, I'll try to share. For everything I see, I'll tell them, see, oh, in fact, some of my old students, I'll keep sending you one thing or the other. So I know sometimes they will say, oh, this woman should leave me now. It depends on what you are looking for in the profession. If you want to specialize in a field, okay, look for a specialist in that field. Ask questions. Read publications. Like I mentioned Dr. Mbada. How did I know Dr. Mbada? Because I read his paper. I read his publication, and then I got interested. I got his number. I started calling him. I started chatting him up. So it depends on what you want. If you want specialist or research or anything, okay, maybe you chat me up later on this. I can be of help somehow. Someone said, how can I get the slides? Yes, I'm recording it. I'll send these things out. I have your emails, okay? I'll send a link to you where you can access it. I dropped my number on the chat room in case, because I may not answer all the questions today. And then after today, you may think of some things that will require answers, that will require clarifications. Feel free to contact me. Even if I can't offer you that help, trust me, I'll send you to someone that can help you if I know the person. Okay. Techno said, please, I want to ask, do we have opportunity to go back on the lectures for latecomers like me? That's why I'm recording it now. That's why I'm recording it. So that when you get the recording, you will now look at it. I've learned so much. Yes, so player, yes, we've all learned. I've also learned from all of us. Thank you. Some of us were not able to log in. Many people are not used to Zoom yet. I've been getting so many messages. I don't know how to use Zoom. I don't know. I sent a link in my emails to educate some people, but it wasn't helpful. If you know anybody that couldn't log in today, today's class was supposed to take 100, but we're not up to 100. So if you know anybody that couldn't log in, just tell them we have another class tomorrow. I'll send out the links and they can join. Thank you. Can I have none? None. If I see 5 nones, I'll end the meeting. Thank you, Ebere. If I see 5, I'll end. Okay, oh, Rita, thank you. I'm loyal. Techno, everybody, thank you. Thank you. A lot of opportunities out there. Really, grab them, oh. Grab, oh. None. Okay, Taiwo has given me 3 nones. Thank you very much. I encourage us to have more passion in this profession, okay? Okonkwo, thank you. Emilie, thank you.